Now, the vaccine rollout is helping COVID cases fall right across the country, but there is one vulnerable population still facing its worst outbreaks yet. The infection rate among Canada's prisoners is 6 times the national average. With us this morning, Valérie Ouellette, who has been reporting on this issue extensively, has more to tell us this morning as she surveyed both what is happening at the federal level and in provincial institutions. Valérie, tell us more about what you found.
Well, Heather, we looked at when vaccination was offered to prisoners, and we found that in many regions, vaccine clinics were offered to prisoners after the rest of Canadians. While we know that infection rates are 6 times higher in jails, and the National Advisory Committee on Immunization had recommended that they come right after long-term care residents and that they be vaccinated before the majority of healthy Canadians. And so that's not the best strategy for any of us to make them wait or make them be last in line, according to epidemiologist Ashley Toot.
The way that COVID is introduced into those settings is because of what's happening in the broader community. And similarly, as people enter and leave the facility, they can move infection. You can't think about the carceral system as something that's completely removed from the rest of our society, because it's not.
So interesting, Valérie, in terms of when those vaccines were offered after the population generally. What about to whom? How many people have received vaccines now?
Well, we've asked that question to the correctional departments of every province and territory in Canada. Here's what vaccination rates look like right now behind bars. So, as you can see, the highest rates are in British Columbia, in PEI, and in Saskatchewan. And then there's Alberta, Manitoba, and Quebec. Around 60% of all prisoners have received a first dose. And finally comes Ontario at 44%. Around half of jail population is vaccinated and has received a first dose at this time.
I know, Valérie, you've been speaking to people who are themselves right now incarcerated or to their loved ones. What are they saying about the rollout and how it's affected them?
Well, we spoke with advocates, prisoners, experts, and they say, first of all, it's really hard as a general rule for prisoners to trust authorities, especially, and even now as they're coming at them with a life-saving vaccine, there is a history of mistrust and of doubt when it comes to the relationship between prisoners and jail authorities. So that's something that many advocates say jails should have seen coming and should have prepared for ahead of time. But the second problem that we're hearing a lot about is the lack of information. So I spoke with one inmate at the Ottawa Carleton Detention Centre. He said the entirety of the vaccination rollout was one poster that was spread throughout the jail saying, if you want a vaccine, sign up for it. He said he had many questions about how the vaccine would interfere with his underlying health conditions. And he asked for a one-on-one with a nurse or a doctor several times, and that didn't happen for him. So he ended up not getting the vaccine. And so we're seeing volunteers going in Toronto jails now, trying their best to have these conversations, to be that person that prisoners can trust with information about the vaccines. So last week they were at the Toronto East Detention Centre, one of the jails in Canada that has the lowest vaccination rate currently. Here's how that went.
Information related to, does it change my DNA, or does it affect fertility? This vaccine was created quite rapidly, so what does that mean, and concerns behind that. And I think the reality is a lot of us in the community have been able to speak with social networks, have been able to discuss some of these concerns with trusted public health providers, medical providers, and people inside just haven't had those opportunities.
And Heather, we also asked the Minister of the Solicitor General, which is in charge of all correctional facilities in Ontario, what they were doing to better inform inmates. So they told us that it was possible for prisoners to get one-on-one consultations with their healthcare staff. They also told us that public health authorities were distributing literature on the vaccine and its risks.
Valérie Ouellette here with me in the studio in Toronto. I thank you very much. Investigating this and full data analysis that she has put together is up on our website now. So you can take a look as we show you that, there are more details of the timeline of the vaccine rollout for prisons and what advocates say has to be done to move this all forward. So thanks, Valérie. That's all on CBCNews.ca.